Hi, everybody. You know my name now. I am going to talk today about the vagus nerve and its important role in immunity, sleep, depression, anxiety, and cancer. And it is a topic that is very near and dear to my heart. And I'm hoping that you will come away today with a little bit more of a love for cranial nerve 10. I went to Hahnemann. My undergraduate degree is in behavioral neuroscience and the history and philosophy of science. So I combined my kind of questioning of religion and science along with behavioral neuroscience, because why not get a second major while you're at college and get your best bang for the buck? Never believing that my behavioral neuroscience was going to come back into my life as much as it is now, and it is right there every single day. So I'm going to put the plug in right now. If you like what I have to tell you right now about the vagus nerve, I can tell you that next year I will come back and kick butt on psychedelic therapy in cancer patients, because that is one of my passions right now. And my pedigree crosses the country. I've been all over the place. I spent a year of college in Hawaii, because when your brother gets killed by a drunk driver and you're a senior in high school and you're the only one home with your parents, you kind of learn pretty quickly how cold, hard reality can be. And I went to Hawaii to heal. I got my pilot's license and ended up coming back to the East Coast because there's only one med school there, and I thought my odds were better to go to a state that had 7 medical schools. So I've been East Coast, I've been Arizona, I live in Arizona, and I practice in Pennsylvania, which is a whole other story. So when I went for my interview at Hahnemann, I came off the elevator and I was kind of nervous because I was going in to see Tom Sedlacek, a OBGYN, and I had no interest in OBGYN. Not that it's not a great profession, but I had no interest in that. At the time, I was going to be a plastic surgeon. And I get off the elevator, and there is Harriet standing there. I'm like, oh my God, these 2 eyeballs and all these nerves were staring at me. And Harriet was actually a dissection of the nervous system that lived at Hahnemann. Hahnemann no longer exists. I don't know where. Harriet might be at Drexel, but I'm not sure. Anyway, it was really a phenomenal thing to walk off before an interview and say, wow, somebody took that much time to dissect nerves. And I didn't think at the time about the importance of what our nervous system does, but now I really know what it is, because I've become very intimately involved with the vagus nerve. We call it the wandering nerve for a reason, because it wanders through our body. We have 2 branches. And today I'm going to talk to you about the function, cholinergic anti-inflammatory pathway, or CAP, inflammatory reflex, immunity, sleep, anxiety, depression, current clinical studies, some of which I'm involved with, and then potential therapeutic interventions. And if you come visit me in Sedona, if you land in Flagstaff, this is the road you get to drive down. It's 89A, but to me, it's the perfect representation of what the vagus nerve does in our body. And I love nerve impulses. Many of you have talked to me already here. You know that I love to biohack nerve signals, because I believe that bioelectric medicine is going to take over in the next decade, and it's going to change a lot of the things that we have done in treatment. I am a healer that chose to be a surgeon, and I still am more of a healer than I am of a surgeon, but I had to get a really good reputation of a surgeon to be able to get invited to stuff like this, to be able to speak. And integrative medicine became my passion, and at an integrative conference in 2015, I got to meet my very first live naturopath. And the first live naturopath that I met, I literally had a girl crush, because Lee Alschuler got up on stage and kicked ass. And I'm sitting there going, how does she remember all these formulas? I can barely make a benzene ring, and she's combining all these things, and I'm going, oh my God, how come I didn't know about naturopathy? Why didn't I know what an ND was before I came to this conference? And so in my integrative medicine training, I'm like, well, the next step I could take closer to be a naturopath is learn functional medicine. And I think that the future of healthcare will really be done by naturopaths. And Western trained doctors who wrap their head around functional medicine, because if we don't get to the root cause of disease, we are never going to change the paradigm in this country. We're never going to change the paradigm in this world. So I applaud all of you, because you're out there kicking butt, taking names, and getting your patients to understand that they have agency and autonomy over what we do with their bodies. So thank you for what you do. So you can clap for yourselves. You guys are great. So we've got two branches of the vagus nerve, and it wanders through the body. And if we stimulate the vagus nerve, we go into a state of rest and digest. I don't go there very often, but I'm getting better at it. It's made up of sensory and motor fibers, and 80% of the fibers are actually sensory. So all of these messages that our body is giving us are coming back to our brain and allowing us to regulate better, which is why, as I'm hearing through these lectures about, autonomic regulation and nervous regulation or cancer patients, every patient that walks into our office with cancer, they are already out of control because they are in fight or flight. They're not sleeping well at night. They're contemplating what's going to happen with their lives. And so that is why this topic is so important to me, because the vagus nerve leads the autonomic nervous system. And although it is seemed to be involuntary, we have control over it. We can take a patient who has a horrible HRV, a horrible heart rate variability, and give them ways to biohack their body. And so emotional regulation is one of the things that the vagus nerve is so good at doing, along with moderating the sympathetic and parasympathetic nervous system. So hang on tight. Keep your arms and fingers inside the tram car, because we're about to take off. So the mind-body connection is bidirectional, and decision-making, clarity of thought, and mood regulation. I didn't realize how important these things were with the vagus nerve until I am a horrible test taker. I do not do well on standardized tests because I go over the things way too many times. And the last standardized test I had to take, I actually used a vagus stimulation technology, and I did really, really well. And I'm thinking, why did I not have that back in college? Because it really would have helped me, because all of that crap I had to regurgitate that I don't use anymore, at least I would have been able to get through it quicker. So Stephen Porges had a theory of polyvagal theory, which talks about the combination and the interaction between social engagement, fight or flight, and freeze and shut down. And if you've got good vagal tone, you have good emotional flexibility, because you can learn how to adapt and adjust. And if we can adapt and adjust to situations better, we're not just spiking our cortisol, we're not getting out of control, and we can get a good heart rate variability, a good HRV, which boosts our resilience, and we get there through the vagus nerve. So the vagus nerve is our pathway to homeostasis. Got it? So I didn't know what HRV was before I started all of this. I know all these people walk around with aura rings and whoops and all this bioelectric stuff to try to give them assessments. And I had to get really educated about HRV to work in this space. And it is the intrabeat variability of your EKG. So the more variable those spaces are between your EKG spikes, the more adaptable your body is to stress in life. And in this little pie chart, and they made this very easy. I think they created this pie chart for surgeons. You guys could probably look at the raw data and get it, but I needed the pie chart. And the green is high frequency or parasympathetic. The yellow is low frequency or sympathetic. And the red is very low frequency, and it's where the central nervous system, it's the backup system that if you're in mostly red, like you're ready to just come apart. And so getting our nervous system back into control is really important. So if you do an HRV assessment and you have 3 equal pieces of pie, you're considered in a state of homeostasis, which means you have enough cortisol that when someone's chasing you down the street, you can run. And you have enough ability to get rid of the monkey mind in your brain to be able to go to sleep at night. And you have a backup system that can pick you up. So this is the parasympathetic nervous system. The brake pedal's on, you're in rest and digest, and you can absolutely just chill out. Your sympathetic nervous system, it's the gas pedal, and it is cortisol, and you need the cortisol when you need it. When you need to run from the saber-toothed tiger, you've got to be able to run. And what I didn't understand at first when I started doing this research was that when someone is so out of whack and they're all cortisol and or they're all like burnout in their central nervous system is just shot. So you got a big red piece of pie. I'm thinking that if I stimulate the vagus nerve, I'm going to watch that green slice of pie go up. But what actually happens first is the yellow piece of pie has to get bigger first, because you cannot sleep and rest until you can run away from the danger in front of you. And so this is a really important piece of information for me, for my cancer patients, because they could be in a kind of a parasympathetic, like absolute smackdown where they're just absolutely exhausted, or they may just not have the sympathetic ability to deal with the situation that they're in. So acetylcholine was identified in 1936. It won these guys a Nobel Prize. It slows the heart rate. And the vagus nerve was initially called the pneumogastric nerve because it not only affected the heart, it affected the lungs and the stomach as well, and the GI tract. And we know that in addition to that, it also regulates activity in the macrophages. So the study that was really important from just a basic HRV perspective was the Framingham study. And what it showed was that if you look at HRV and heart rate in patients, particularly men were more affected than women. If you have a high heart rate and a low HRV, you have a higher risk of cardiovascular events, and then you also have a higher risk of dying after a cardiovascular event. And so just simply looking at your patient's heart rate unless they're on a beta blocker and you made it slow, but if you're looking at their heart rate, if their heart rate is elevated, it means that they don't have as good a response if they have a cardiac event. So we can follow HRV, we can look at heart rate, and these are all metrics that we can monitor in our patients. The vagus nerve is a wonderful two-way communicator. Not only does the vagus nerve send signals out to the body, but like I said, 80% of those fibers are coming back to the brain with a message. And so there was a study that was done by Dr. Watkins in the 1990s. And what they did was they took interleukin 1B and injected into animals, into their abdomens that had an intact vagus nerve. And when they injected that into the abdomens, it incited 6 symptoms. So that interleukin 1 was, initially they thought it was taken up by the, by the bloodstream and created those 6 symptoms. But when they injected the same substance into animals that had a vagotomy, there was absolutely no sick behaviors, which basically lets you know that it's the afferent fibers going to the brain of the vagus nerve that signal to show fever, loss of appetite, and social isolation. It was absolutely not related to the blood at all. And to me, that just shows you the power of this nerve. And it also shows me the power of our ability to use bioelectric medicine to our advantage for our patients. So this book, The Great Nerve, Kevin Tracey, love this dude. He is a wonderful neurosurgeon. It's a funny book too. He's very self-deprecating in there. He talks about how he went and tried to do all these things and how he didn't find enough evidence for cold plunging, but he said he didn't think it would hurt. So like at the end of a shower, he turns the shower to really, really cold for like 3 minutes. He said, how can it hurt? Even though there may not be enough data yet, it wasn't gonna hurt him. But he described the healing reflex. And this, what they did was they took a drug that they were experimenting with and they injected it into the brains of rats. Through the vagus nerve, that got sent down to the body. And are they coming for me? What they were able to identify is that the acetylcholine was acting on the alpha-7 nicotinic receptors in the macrophages, and it reduced tumor necrosis factor by 75%, IL-1 and IL-6 as well. That is a pretty big response. And so if you think about the fact that stimulation of the nerve through a drug can create that response, imagine what we can do with the right stimulation. So he was able to show that the vagus nerve is a neural brake on inflammation. And inflammation in our day and age of practicing medicine is like infection was prior to the advent of antibiotics, okay? And people used to die of infections that we can now very easily treat. But I also believe that in the future, in the next decade, we're gonna find out that we can use bioelectric medicine not only to help us in cancer patients with the things we're talking about today, but to also treat different organisms in our body. And if you got a copy of my book, I tell the story of my sister who got vax injured, and we used biomagnetism to rid her body of Epstein-Barr that came out wild after her jab. And I'm not afraid to say that. They can come try and take me out, but I have a Kevlar vest, and that's why the microphone fell off, because my Kevlar vest is really tight. Anyway, knowing that there is two-way communication between the vagus nerve and the brain lets you know that our bodies know how to heal. You guys get it. So many other clinicians do not understand that our bodies know how to heal. They think that our body needs to be told what pill will treat, what symptom which will treat, whatever, but it never goes back to the root cause. And so I love the fact that the research clearly shows that when you transect these nerves, it changes what happens downstream to our immune system. And this cholinergic anti-inflammatory pathway is so important because you can target the inflammatory diseases by stimulating the vagus nerve. Kevin did a study. There was a patient, this woman had horrible, intractable Crohn's disease. And she received one of the first implantable vagus stimulating technologies. And her response was within weeks. She was off all of her meds. She was no longer needing assistance in walking. Her life came back to normal. And when she was back in the United States and she was telling the story somewhere, because she was up, talking, probably helping to raise funding for more research, he has a quote in the book that a CEO of a pharmaceutical company said, "Listen, your story's really incredible, but if what you're saying is true, this is gonna put me out of business in the pharmaceutical industry." And I say, hell yeah, because to be able to treat a chronic disease like Crohn's disease by stimulating the vagus nerve, getting the patient off steroids, off all of the immunologic drugs that they have to take, and give them quality of life, because so many times we treat diseases with medications and we're trying to treat a symptom, but the patients aren't getting better. We're just kind of keeping things at bay, and we can't keep doing that. So the cholinergic anti-inflammatory pathway is really important because what it does is it uses all of these fibers in a bridge going back and forth between the brain, the body, the immune system. And this bridge can be crossed both ways. And that's the part that we need to really look at as professionals to be able to get our patients better. Getting back to homeostasis is what it's all about, because our body knows what to do when it's in balance, but when our body's out of balance, that's when we need help. And that's where this healing reflex comes in, because the vagus nerve, initially they thought it was just responding to peripheral inflammation, but we know it goes both ways. And this cholinergic anti-inflammatory pathway, or CAP, is one of the things that we can use to biohack for our patients and give them immune modulation. So this reflex, the mechanism, again, it's acetylcholine that binds to the nicotinic receptors and inhibits inflammation. And inflammation is what we know causes a ton of diseases. And if we can do this for rheumatoid arthritis, which we have already, if we can do it for Crohn's disease, there's nothing to say that we can't do this for cancer, because we know that cancer comes after a host of inflammation. So we're all dealing with our patients. They get fatigue, they get pain, they get depression, they get cognitive impairment. And if a patient gets a vagotomy, it increases disease progression. And if they have more inflammation, you can get tumorigenesis or progression of disease. So if we can stimulate the vagus nerve and stimulate parasympathetic process, can we improve the outcomes in our patients? And this is one of the things that I plan to really kind of hammer and nail for the next 10 years of my life. So what taught me this? I was a speaker at an endometriosis summit. I know I'm not a gynecologist, so why was I there? Well, I work with Signal Relief, and they have a patch for menstrual cramps, but it actually works in endo. So I got invited to be a speaker at that conference. And so I had to take a deep dive because I had never given a talk on the science of pain. So I took my deep dive, And what I found while I did this, and I was at the time already using the vagal stimulation technology, was there is a role for the vagus nerve in endometriosis. And if any of you know anyone with endo, 10% of women have it. I've operated on it. It is the ugliest pelvis you ever want to see. It looks uglier than any cancer because everything sticks together. My girlfriend's a gynecologist. She can tell it's a crappy pelvis to go in. And the reason that I know how bad they look is sometimes we didn't make the right diagnosis and the patient didn't have appendicitis, and I put my laparoscope in and I go, because I was a general surgeon for 14 years, I go, oh my God. Then I got to call the gynecologist because I'm chipping away at organs that I'm not supposed to touch. And so I learned how pathologic endometriosis is. And it is a benign cancer because it acts like a cancer. So I said, what can I learn from this? So what they found was that the vagus nerve's role had been relatively unknown, but women that are stressed, that are in cortisol storm, that have poor neural mediation have worse disease. And so what they did, they looked at their EKGs and HRVs, and you could divide them into groups, normal women and those with endometriosis. So a very smart scientist said, instead of experimenting on women with endo, let's experiment on mice because they're less expensive. So in the lab, they took 3 groups of mice and they put endometrial implants, the same number in each mouse. First group, they stimulated the vagus nerve. Second group, they cut the vagus nerve. And the third group, they just let the endometriosis grow at bay. And what do they find? If you do a vagotomy, it accelerates the progression of endometriosis and the volume of endo goes up precipitously. So it kind of tells you that there is something going on there. When the vagus nerve was stimulated, it decreased lesion progression. So it actually, the endometrial implants didn't grow. You still had the implants, but they weren't propagated. So then what they did was they took the well-established group, the mice that got nothing, and they went back and stimulated them. And what they were able to do was get those mice to go back to the place where their endometrial implants were just done. And when I read this study back in 2021, I was asking there were gynecologists from Harvard and Tufts and everything. I'm like, guys, are you doing research on this? They're like, well, we never heard of it. We didn't know. I'm like, if it works this well in a mouse, we can stimulate the vagus nerve in women with endo. And I haven't had endometriosis, but I've met women that have it, and it's a crappy disease. And this is a way that we need to go after it. So learning about this through endo made me think we got to be able to do more with cancer, because cancer comes from inflammation, poor diet, smoking, infections, obesity, and the body's immune response to all of those inflammatory processes sends us on this cascade to propagate cancer. And so if we don't break that chain, if we don't break that pathway, our patients are just going to get cancers. And whether patients want to believe it or not, we all have an opportunity to biohack our body's ability to make cancer. And being in this group, I go to some of my conferences, and I can say that some of the people there are not the healthiest specimens in the world. They do not practice what you preach. I can tell you the food that we're eating here is freaking awesome. I don't know who did the menu, but you have great healthy choices. I did see a few of you at the bar, but as long as you keep it at bay, I'll be good with that. But to know that inflammation is one of the inciting factors in cancer, we have an opportunity to change that in our patients. Anxiety and depression, PTSD, I see it constantly. It is whether it was being, I say patients come into cancer and they have luggage, right? And you have those little packing cubes. So when you pack, you can put a lot of stuff in your packing cubes, then you put it in the luggage. And they come to your office and they're diagnosed with cancer, and suddenly 3 pieces of luggage are opened up and all their clothing is out of the packing cubes. And you're looking at them and you just want to treat their cancer, but they came in with this baggage. They come in with adverse childhood experiences. They come in with life trauma. And whether they were under good control or not, the level of anxiety and depression and PTSD goes up. 80% of women that get breast cancer have PTSD symptoms. And they get flashbacks, feelings of detachment, feelings of numbness. And it's not always related to the cancer, because it can take them back to prior traumatic experiences in life, which led me to the psychedelic therapy part of my world. Because when you get PTSD from your health system, because they have been complicit in covering up 80 women that had a delay in diagnosis and they want you to continue to lie to them, you go home at night and you have PTSD because you can't not live your truth. Because if you're not living your truth, your body's going to take it all in and then you're going to get sick. So during my time in practice, I've asked every device company that I've worked with, because I've worked with a lot of surgical device companies. They make these beautiful little things called plasma blades and photon blades that create less trauma in the tissue. And I look at them and I'm not kidding. They think that, it's kind of funny because I'm talking to the development team. And I say, give me a device that cuts out the fear when it cuts out cancer. Because fear is the thing that paralyzes patients and shoots their cortisol up. Nobody has been able to make that device, but God made it, and it's a little mushroom, and it's called psilocybin. It's amazing. So I didn't know about it because I was like the I'll never do drug person. Like my dad was a cop, so like it was a no-go. And for me to, my kids were like, for me to do psilocybin, like, Mom, like you had the little kit on the table, so if they came home looking funny, they were going to pee in the cup. And so for me to have to fess up to my kids that I went and did psilocybin because my health system broke me, they were like, wow. And now I know. So breast cancer patients, a lot of them have depression, and 22% had moderate to severe depression. And what's the first thing the primary does? SSRI. So they put them on an SSRI and they send them back to me. And then they're like this. Oh, Dr. DuPree, well, I guess the cancer, and they're numb and they're flatlined. And I'm like, oh my God, you've got to be able to feel the emotions. And I don't like the effects of SSRIs on cancer patients. First of all, because it doesn't work. Study clearly showed that only 40% of patients had a positive effect. And that is 38 to 42% is placebo. And I took the deep dive on this, and this is one of the ways that I kind of got to the place where this is why I've got to get trained in psychedelic therapy, because if my patients are continuing to be depressed and have anxiety and PTSD, I've got to have a way to help them. So depression is not a lack of serotonin, and this research was amazing. SSRIs have an anti-inflammatory effect in some patients, and they do that by suppressing pro-inflammatory markers, TNF-A, interleukin-6, IL-1 beta. And so these mechanisms, of course, they're going to work in some patients, but it's not because you have a deficiency in serotonin. It's because when depression comes, it can also be the cause of, when inflammation is present, it can also be the cause of depression. So another book I highly recommend, Anatomy of an Epidemic. Awesome, awesome book. Whitaker literally walks you through how Big Pharma developed Thorazine and Valium. That's why I wear a Kevlar vest. My mouth is, there's no filter. It was one of the best books I've ever read because it really gave me the true history of how pharma played the doctors, how SSRIs were tested for 8 weeks. 8 weeks. People are on them for 8 decades. Kids are being put on them, and there's a black box warning to not give them to teenagers, and parents are not told about the black box warning. So, great book, recommend it, highly recommend it. So the vagus nerve has already been bioelectrically hacked, thank God, because inflammation causes depression. And the implantable devices wouldn't be working for depression if it wasn't an inflammatory reflex. So in 2005, the FDA cleared an implantable device for treatment-resistant depression, but I'm sure the lobbyists were part of this. You have to fail 4 drug interventions to get the implantable device. So as we're going to go forward, you're going to see the technology that I'm working with. Why would we not be treating depression and anxiety and PTSD with non-invasive stimulation of the vagus nerve and make pharmaceuticals something down the line? Oh, it doesn't make them money. That's why. I forgot. So these feedback loops are where we can biohack the body. All right? Stress leads to catecholamines, leads to increased cytokines, leads to inflammation, and this is the hamster wheel that's going round and round and round. But if we can break that and stop that stress response, if we can stop that cortisol storm, if we can improve the vagus nerve's ability to downregulate and decrease inflammation, we got a way to break the cycle. So, therapeutic interventions, vagus nerve stimulation can happen with an implantable device. It started out like a pacemaker, now it's down to like the size of a pill, but it's a surgical procedure. Obviously there's risks and benefits with that, but the number of implantable devices is like in the tens of thousands now. I mean, we're helping so many people with this. And this woman that had Crohn's disease, like her life was completely changed. She got her life back. Her life was completely changed and she had been written off with everything else. So if we look at non-invasive vagus stimulation to reduce cytokines, to decrease inflammation, we can then also go, okay, wait a minute, what else can do that? Oh, breathing. Do you guys have breath? You guys breathing? Everybody in this room breathing? Okay, good. So we all have breath. We can learn to meditate. Anybody in this room exercise? Yep, okay, cool. Anybody know about the dive reflex? You put your face in cold water, you go into a cold lake, you can survive way longer. After you drown, they can revive you because our body knows how to slow itself down and we just need to biohack that. So I love this study because it was 20 minutes. Patients went into their doctor and either had 20 minutes with their doctor, and I don't think they could have done this. I think they did this with orthopedic surgeons, because if they had done this with naturopaths, I don't know that the results would have been so good, because you guys are great active listeners. You are participating in your patient's care. You probably don't put an electronic screen in front of them. You probably actually have connection to your patients. But in this study, in the British Medical Journal, they looked at 20 minutes of mindful breathing compared to 20 minutes of supportive listening by the doctor. And the breathing was statistically significant to improve the patient's pain. Pretty easy to do that. So a couple years ago, I was introduced to, I've traveled to India a bunch of times. I'm inducted into the Indian College of Surgeons. I know I really look the part. Prem Lakshmi here. I went to India, and I really kind of got very, very deeply involved in the yoga culture, in the breathwork culture, seeing the benefits of it. And I worked with a yogi named Babaji, and he sent his son to the US, Ishan, and I helped to sponsor Ishan's visa because he wanted to come over and study the effects of breathwork on the human body. And at the time, I didn't know if he was just going to come over and like party wildly at Stanford or up in San Francisco as they do. But he came to the US, he took this seriously, and he started a program called Yoga of Immortals. And what this was an 8-week program that had 30 to 45 minutes in the morning, 30 to 45 minutes at night, had 73% decrease in depression, 75% decrease in anxiety, 82% decrease in insomnia, and 77% increase in quality of life. You show me a drug that does that, right? These are things that our patients can learn to do. These are things that we can learn to do. But you guys live in the US with me, right? And people they want the quick fix, right? Like you walk into your office, what can you do for me right now, doctor? Like, what can you do for me right now? And so although I know that this improves resilience, I do know that breath is medicine. And I don't think that we need to have bioelectric medicine to be a part of our every single day. But I think if we can get our patients to get there utilizing bioelectric medicine, we can then give them the tools to stay there. We can then give them the opportunity to learn how to breathe. And I don't know about you guys, but I'm kind of a nuclear reactor. And if I'm in a situation where somebody has pushed my buttons, before I open my mouth and regret what I'm about to spill out, I'll take 3 deep breaths, try to stimulate my vagus nerve, and get to that safe place. But there are people that walk around every day that are living in a state of anxiety. And I was on a call with one of the companies I work with, and they were introducing me. I was doing a lunch and learn for a company that has a decision RT. It tells you whether to give radiation or not with DCIS. And not this Corey from here, but there was another Corey. She was saying, how do you want to be introduced? And I said, I wanted to say I'm a surgeon with, at the time it was like 35 years experience, integrative medicine, trained in psychedelic therapy, working bioelectric medicine. She's like, well, I'm not going to say all those things because like, I don't want you to lose your credibility with our audience, and I said, well, Corey, here's the deal. This is who I am. This is what I do. This is how I do it. And if you don't think that working with a company to stimulate the vagus nerve to get rid of anxiety is important enough, or taking women to Mexico to do plant medicine is important, I probably shouldn't be your speaker. So it's up to you. Anyway, after the call, one of the women, Dee Dee, calls me back. She's a nurse that worked with them, and she said, my daughter lives with incapacitating anxiety. And she's about to get married. She's had cancer twice. And what is it that you're doing? Because I want her to have it. And so Maddie, they came through Sedona 2 weeks later, and I put Maddie on the Mind Vibe, which is the non-invasive device. And literally after a 25-minute session, she walked up to me and she goes, is this what normal people feel like? And it broke my heart, because here's this beautiful little 30-year-old who's about to get married, who never had a non-anxious moment, because as with her cancer diagnosis, things just kept escalating and escalating. And she didn't have the ability, nobody had taught her how to get back there. And so, I did the treatment with her, and I mean, that was one of those moments when I'm like, all right, you need to make this part of your life. This has to become a priority, because she's not alone in the world. She's not the only person that's dealing with cancer. And we have an opportunity to utilize these technologies in our practices to help our patients. So in cancer, high vagal tone measurably is associated with improved prognosis, less stress hormone release. There's not a lecture I heard here that didn't talk about the tumor microenvironment or the immune system, and building up the immune system, building up our ability to kill these cells. And there's evidence in preclinical and human studies. And so to me, this is another message that we've got to find ways to do this effectively and to bring this into mainstream care. The vagus nerve is also incredibly important in sleep, and parasympathetic regulation promotes rest and recovery. Our bodies heal when we sleep. So if we've got our patients who have cancer and they are up every 2 and 3 hours, they're never going to get that good quality of sleep. And so what I realize with this is that it's not just one thing. The vagus nerve is doing so many things. It's regulating the immune system. It's decreasing the inflammation to decrease the depression and the anxiety. It's improving the body's ability to sleep. So the fact that cytokines and inflammation cause depression, and all of these things also cause cancer, is it any surprise that individuals that have 4, 5, 6, 7 adverse childhood experiences, who live in a state of fight or flight, have up to a 200% increased incidence of cancer? So it's all part of this cycle, and they're not independent. They're not just isolated factors that here's the silo of mental health, here's the silo of your gut microbiome, here's the silo of cancer. These are all interrelated, and patients with low vagal tone have more anxiety and poor recovery. So we're all getting on the same bus today. Exercise, easiest thing to do. I love to exercise. This is actually me on Bear Mountain in Sedona. So if you come out to Sedona, you can come to Bear Mountain with me. I'll go hiking. It's a very hard hike. It's a thigh buster, so it hurts as much going down as it does going up. But we know that HRV, if you're exercising, increases the SDNN of your HRV, which is kind of the overall factor. If you're wearing a little wearable device, it's measuring your RMSSD, which is your root mean square distance between your heartbeats. And we know that stimulating your parasympathetic nervous system is like exercising your body's immune muscle. So I think we need to be doing more research on exercise. 2005, I gave a lecture at the American Society of Breast Surgeons on integrative oncology and breast cancer care. And I remember some of the older dudes saying to me, well, Dr. DuPree, you're really out on a branch with this integrative medicine thing that you're on. And I'm like, well, you know what? It's a really strong branch. I picked a good branch so that the rest of you can come out with me, because I guarantee you that 10, 15 years from now, you're gonna be on that branch. And the most beautiful thing is the past president of the ASBS, Dr. Jay Harness, his branch is even bigger than mine, because he is all in on exercise oncology. And, he's not late to the game. It's just that you sometimes need more powerful voices to put those messages out there, to be able to get people to recognize that we need to be giving our patients the opportunity to use exercise to strengthen their nervous system as well. So our device is a wellness device. It improves well-being disturbances. So how do we do that? You can stimulate the vagus nerve through the ear, through the neck. You can implant a device in the neck. They're also using ultrasound waves in the spleen. And nerve fibers are just amazing, what they do, how they do it. And like I said, I'm a nervous system biohacker now. I chose breast cancer to research because I have a breast cancer population. It's not like I was being, trying to get rid of other people, but like these are patients right in our office. My partners did the study because I work with a company, so I'm just the smart person that decided to do the research, I guess, and they're the smart ones that got the patients in. So what do? This technology stimulates the vagus nerve at point 0, right in the ear, where the vagus nerve is very superficial, in the neck, and we also use stimulation of the acupressure stimulation, acupoint stimulation. Dr. Yakov Katznelson is an amazing neuroscientist and anesthesiologist from Russia. Found all of this to be related because in Russia he had a lack of analgesia for patients to go under surgery. So this is his years of research have culminated into this trial. We used validated metrics. Everybody does the NCCN distress thermometer in breast cancer. We have to do it every time they come in, so we use that as a validated metric. We added the PROMIS fatigue and insomnia score because I met a young PhD from Penn whose mom happens to, well, now she's my patient, had suggested that we add this to our study. And I used HRV as a metric because I wanted something that anyone that reads a paper can't say, well, your patients are just, they're happy because they were sitting in a room, blah, blah, blah. I needed something that was absolutely objective. And so 60 women, open label, 50-minute simulation, 25 minutes one side, 25 minutes the other. After 5 sessions, we did their HRV before they started and after 5 sessions, and it was 5 consecutive days in a row. Highly statistically significant improvement in personal well-being in the WHO-5, decrease in stress with the NCCN distress thermometer, improvement in fatigue, and improvement in insomnia. You tell me a pill that does that in 5 days. Doesn't happen. We followed these patients out. At 12 weeks, we still had long-term lasting effects. And we were able to show with the HRV that those patients truly had a shift in their autonomic nervous system. And if we're shifting it in 5 days, imagine what somebody could get, like while we're in the midst of cancer treatment, to be able to continue to stimulate their immune system with the vagus nerve to improve. And so every green box tells you we're on the right path. I know I'm on the right path. I've recently been introduced to another bioelectric technology that uses ion cyclotron resonance. I didn't even know what it was, but again, it's frequencies, and it's using bioelectric medicine to shift the body to a place of healing. And if your sympathetic system is in overdrive, you're floundering. You're stuck. You're stuck in fight or flight. You can't get out of it. Our patients need to get out of it. And so I know that homeostasis and neurohomeostasis is the key to health. If we have a balanced piece of pie, we can run when we need to, we can sleep when we need to, and we can respond appropriately to stimuli. The vagus nerve stimulation, I believe, is the key to normalizing homeostasis. It's running the program there. And to be able to do this and to get our patients into a state of flourishing through a non-invasive technology that's inexpensive, that's going to allow us to alleviate the fight or flight, we can then teach our patients to do the yoga, introduce the breath work, introduce practices that stimulate their vagus nerve. Sitting up here listening to this last lecture, singing, humming, anything that stimulates your vagus nerve is going to improve your HRV. So I've been a cancer surgeon now for almost 4 decades. Been in integrative medicine for 3 decades. Been working in bioelectric medicine for about 14, 15 years. Been a student and now practicing what do I call I'm a facilitator. Oh, I've been a practicing facilitator in plant medicine now for 4 years. And I know beyond a shadow of a doubt that bioelectric medicine is the future of healthcare. And these are the things that we need to use all of your knowledge on all of the supplementation to improve the microbiome, to improve the extracellular matrix, to give our bodies what it needs to heal. Right now, you can use the bioelectric medicine and you can use it in epilepsy, depression, investigated right now in rheumatoid arthritis, Crohn's disease, fibromyalgia, anxiety, irritable bowel, and cancer. And what we're going to do is we're going to see that neuroimmune bridge is going to keep getting crossed more and more and more. It's going to improve our patients' ability to sleep, improve their mood during the day. It makes our mood better because we're not feeling like we're pulling our patients back off the cliff. Potential integrative therapy to help our cancer patients and to prevent cancer. And lifestyle strategies can augment vagal tone, but we're not practicing them nearly enough. This technology that we've developed it's going to be a take-home device. We want it to be home. We don't want patients to have to come back to the office to do this stuff. And imagine if we have a take-home device, we can help kids with anxiety instead of putting them on SSRIs and anxiolytics, and allow them to get off their screens, which are the biggest part of the problem, and be able to help our community to not get cancer again. And I think that I think we're on the precipice of a big change with bioelectric medicine. And I've loved my career as a breast cancer surgeon, but if I don't ever have to operate again, I'd be very happy, because I know that when I cut out that cancer, I am not cutting out that patient's fear. I am not changing their microbiome. I'm not changing their immunologic ability to fight off cancer. But I know that through the things I'm doing bioelectrically, through the things I'm doing in functional medicine, from the things I've learned from all of you, Lise Alschuler, shout out again. You are badass. The future of medicine, it's going to integrate immunologic and bioelectric approaches. And I think that the drug companies are going to hate me. And if I am not suicidal and if I disappear someday, I'm telling you, I met Lise 3 weeks after Mitch Gaynor was no longer with us. And that was like a slap upside the head, because to see individuals who are so bold and so amazing in our fields just disappear for no reason, it tells me that we're doing the right thing, and we all are right now. And so if you come to me in Sedona, you can see this on my porch. You must be the change you wish to see in the world, and you guys are. You can find me on social media, and I couldn't find a cloud that had a question mark, so I put my arrow in. So if you have any questions, I'm happy to take them. Thank you.